Yes. So MSD for Mothers is an initiative of MSD. MSD is a US-based pharmaceutical company. We're known as MSD. Everywhere outside US and Canada, we're known as Merck in US and Canada. And MSD for Mothers is focused on improving maternal health outcomes globally. Nigeria is one of 4 focus countries. Our interest in Integrate PACS is really because the PPMVs and community pharmacists increase the access of people in peri-urban, rural areas, increase access for them to family planning commodities. And research has demonstrated that if the women who don't want to get pregnant have access to family planning counseling, family planning products, that we can actually reduce maternal mortality by up to a third. I've heard somebody recently call family planning the vaccine for maternal mortality. So this is why we're invested in the Integrate PACS project. And I think in terms of the impact of the project and what the project has achieved, I will direct you to speak to SCIDA and Society of Family Health, who have implemented this work as co-implementers, as collaborators. The project was really seeking to sustain the gains of the PCN 3-tier accreditation model, working with community pharmacists and PPMVs, recognizing that these stakeholders, these community trust brokers, as I call them, have identified that there are 3 things that will help to sustain the program from their own end. The first thing was access to finance. The second was access to quality commodities. The third was branding. This particular program is focusing on the efforts around the access to quality commodities. One of the things that they're sharing today is what their findings were around the sourcing when PPMVs and community pharmacists are sourcing their medical commodities, their drugs, from a transparent supply chain according to the national distribution guidelines. When they're sourcing through VMIOs, which has been facilitated through the work of the Society of Family Health on this project, the results are showing an improvement in the quality of medicines from these PPMVs. That's something that we are all here for. We want to see better quality medicines reaching our Nigerian women through community pharmacists and PPMVs. And so that's an exciting thing that we're hearing from the implementers of this project.